sorry. Same. I do think we need to focus our efforts on a full revamp for next year.
For 25.
So I think that given the short time period, I would also agree with that mindset.
Perfect. Do we have a motion to approve the fiscal year 24 CEO performance goals?
Moved.
Second.
Properly moved and seconded. All in favor?
Aye.
Any opposed? The committee recommends the fiscal year 24 CEO performance goals to go to the full board for approval. Let's move to fiscal year 25. I will pass the mic to Mr. Lesser.
Ooh.
Listen, I'm
Said
going to
it
get it.
correctly
I'm going to get
today.
it. I'm going to get it.
Okay. Yeah.
It's all love. It's all, yes.
Well, it's getting deep.
I am silly today.
I
I'm hungry
know,
too.
because you're seeing.
I'll pass it to you now.
Madam Chair, I would like to introduce to the rest of the board some suggestions that I have made.
Okay.
I think at this stage, it would be important, as we've discussed at the last committee meeting, to begin the year fresh and have it ready to go for the CEO on July 1st.
Agreed.
So that he has a full year to walk through whatever the language is. Given that, what I did, just for suggestion's sake, for consideration by the members, is I took the basics of what we have already, and I added a couple of things and changed language on a few things. I think it's very, very important to have assistance in going through this process with professionals. And in this case, we have a professional.
Yes.
We have our HR director here, who I have spent a few minutes with to discuss some of my suggestions, and she has some as well, utilizing the same basic format of the American Hospital Association recommendations.
Okay, perfect.
So what I've suggested, and I think I've handed out to you and to Ms. Smith, is not the kind of detail that I think ultimately we need to have, but at least to begin us on that path.
Definitely.
By having a little bit more cohesion and a little bit more direction for the CEO. But I think at some point, and I would hope that we'd be able to do this early in the 25 fiscal year, to refine it even more, to give more specific numbers, if you will, to certain of the suggested goals. And if you like, I can go through my suggestions.
Yeah.
And again, they're just suggestions for your consideration.
Okay, that sounds good.
So with that, putting the attachment A that we've been using from the self-evaluation, what I walked through was first in the quality, well, it's not, I guess it's not in the same order, but in the financial category, just to make it simple, changing the word finances and financial to adhere to the same template as the AHA document, which talks about financial leadership, which is very specific. And to meet, and it says meet of, that's my mistake, it's meet or exceed financial goals, not merely meet the budget.
Okay, and just to make it easier for Ms. Lester, as she is helping us keep track, we're looking at the 2024, and if you look on the second where it says financial, instead of saying just financial, it would be financial leadership, and then under goals and objectives,
Yeah.
it would say meet or, oh, does that help? Okay.
Substantial language.
Thank you.
And then eliminate prior year clean audit and substitute ensures a clean annual audit of financial operations with a careful and thorough review by the board.
Okay.
Some of this is stuff that we are assuming takes place, but I think it's important to put it into the language.
For sure, for sure.
In the quality category, I would merely add the word improve to the measurement criteria rather than just meet certain measurements. It should always be constant improvement.
Okay.
Where's that?
So that would be improve or maintain?
Under quality, and forgive me, I should have done this right. Okay. Where it has measurement criteria, review the leapfrog grade.
Oh, yes,
Correct.
yes.
Improve the leapfrog grade.
Got it,
grade.
okay.
Same thing with the quality report for the fiscal year. Improve.
Okay.
Okay? And then ensures appropriate resources. And some of this language may not fit, depending on what y'all think is best. It may be in another category.
Yeah.
But ensures appropriate measures are allocated throughout the organization to deliver high-quality, patient-centered care. I think that's another area, and that's under under quality, which I'll give you this, Janet, because that's what I wrote from. I think we're assuming these things, but I think it's important to put them into words.
So under quality, we would just add a third bullet that would
Correct.
say and add insurance. Okay.
Correct.
Okay.
All right. Then in customer service, add ensure that quality and patient safety is a top priority at every level of the organization.
Okay.
Now, there may be additional objectives in this category, but I'm going to walk through a couple of these, and that has to do with board relations and communication category,
Okay.
because I took a little bit more time with that. Adding to keep the hospital board informed, which is under the goals and objectives. And may impact the hospital's sustainability, growth, finances, and public profile.
Okay.
Okay. Then, under keeps the board fully informed of important development issues on an ongoing basis.
Okay.
And again, Janet, I'll give you this because it has the exact.
And I was going to say, I could go in, because didn't I go back and put it in and then we sent it out
Yeah.
and then okay, yeah.
I think you did some.
Okay.
Yeah, we can do that. Just a clean copy for everybody.
And then under the last category listed under the measurement criteria, under the CEO provides clear and timely information to the board and continuous education to the board on an ongoing basis.
When you say continuous education, well, I guess maybe I'll let you go through. and
I
then
think
can
it's important
ask.
that board members are not coming into every board meeting cold. That there's background information shared by the CEO on important issues prior to the board meeting.
Got it. Okay.
Yes.
Okay. Got it.
And then I added some additional objectives, and these are not where I'm not quite sure where to place them. The CEO seeks community partnerships to maximize resources and impact on the greatest community health needs. And that's not my language, that's AHA's language.
Okay.
Collaborates with community leaders. And I know that that is taking place, but I think it ought to be a very specific goal, which I'm not sure exactly how to enumerate in terms of how we know that's being done on a regular basis.
Yeah.
Leadership team relations and development, my understanding is there's a significant amount of this kind of work that's already in existence, but I think it's important that there be a line of assessment for the CEO on this issue. Leadership team is extremely important in their growth, and so I added ensures meaningful and challenging goals for performance improvement and develops future leaders within the organization. And that's not just on the executive team, but that's throughout the organization.
Okay.
Building a bench and making sure that we have quality talent. People go on vacation, people leave, and we should make sure that we maintain a good bench.
Great.
This is an area I think is particularly important now that we have a foundation director, works with the fund development staff and foundation board to implement a fundraising program that sets and meets established goals. And last but not least, establishes relationships with prospective donors. This
To the
is
foundation, the hospital, or just all of the above?
all of the above.
Okay.
And again, I give that to you, Janet, because that might help you.
Okay.
And those are some of the suggestions I make. And I leave that to you, Madam Chair, for
Okay.
your consideration along with the other member of the board.
Yes, I was going to pass it to Ms. Smith and see if you had any comments on this or concerns or anything you wanted to add as well.
Yeah, I think, first of all, I think, Craig, you've done an excellent job, and I appreciate the time and diligence that you've taken to be additive to the current structure. So that's impressive, and I echo everything that he said. I had actually taken the opportunity to meet with a prior CEO of a healthcare company here and had gotten some information I thought that was also not necessarily something we have to necessarily implement in the objectives, but I'll just read through these real quickly if you would give me some time on that, because I do like the messaging, and I think this person also was able to, it was a transformational story and served a similar population. And so I think it's not somebody that came in at a high level and just, status quo. So these are some industry imperatives for a hospital. Establish and promote favorable reputation of the medical staff. Deliver excellence in selected service lines. So that can be lots of different things, but maybe we pick, 2 or 3 that we focus on for that year. Demonstrate steady movement in the ambulatory space and telemedicine, as those are very important pieces currently. Strive for positive relations with all payers. Meet all relevant quality standards and thresholds, Medicare, Joint Commission, et cetera. Maintain strong risk management and safety programs. Share these results with staff. Support and communicate constantly with the caregivers, clinical and non-clinical. Recognize and empower mid-level managers in the decision-making process. Continuously recruit new physicians. Participate in group purchasing organizations, including an ownership stake. Consistently review and test the security of the IT systems. Maintain superior plant operations department. Allow liberal visitation for the family members and assisting with their care and communication. And encourage frequent rounding by nursing staff on inpatient units. So, like I've said before, I'm not the hospital expert, but a lot of these resonate well with me. And these have clearly been successful steps in someone who's had a transformational experience from running a hospital that had a similar population and going from significant red to positive black. So I just wanted to bring those up because I thought they were some nice points. Thank you.
No, and I appreciate that. And I was going to ask, is it possible to get a copy of that or to share with us? Because I almost feel like it might tighten up some of the more broad categories that we've already compiled. And I don't want to make an executive decision without hearing from the team as well, but I appreciate that. And I think that can take you from good to great. So
Yeah, I think those are great suggestions. I would also like, if there are no other comments or questions for Ms. Smith, to ask our HR director for some comments. I know she has reviewed the assessment as well, the evaluation as well, and looked at the AHA base. And if you have any additional comments, I think it would be great to hear from you.
I do. So
All good.
Yes, all good things. So one of the things that I did notice that we didn't have here, we spoke it right off the bat, but we don't have any components around, is our mission. So I added the mission statement components. Now, we do have the quality and patient component, but we don't have the research component in there or the training tomorrow's caregivers. This is something that we're 100% dedicated to, and we can develop metrics around how we're successful in doing our mission. And I think it's important that our mission, since we declare our mission every time we open the meeting, that we have something that states what we're doing. So just wanted to add that, and we can get some metrics around that. I also had the financial goals as well, and some of the elements that the same, including we have a strategic plan for growth. We know what that is, and are we working our strategic plan? And then medical staff and relations and growth, similar to what Ms. Smith has said. You know, what are we doing for the collaboration and systematic care? The community partnership and outreach, we're in the community all the time. And I was explaining that we don't talk about that much as we should. We are in the community regularly every month. I have the calendar here. There's nothing less than 3 times that we are at community events, community places, doing healthcare events throughout this entire community. And I think that should, and it's very measurable. You can say whether or not you're successful in that. And of course, as we're in the community, that means that there's more awareness of who we are, what we do, and how we do it. And so we're delivering care. And we have found patients that had to have an immediate response to the fact that we were out in the community. We're about to be in the community, in fact, next week. So we've had that happen before where we had to have response. So I think that's something that we can do as well. I also had the board relationships. I think it's important that we have information, going back and forth and on topics and training. And I also had the fundraising and development. As you know, we're in the process of developing for a new space, a new place. We must have something in there to talk about what are we doing? How are we getting there? And I applaud the board for making this change, because this should be always a positive thing of where we've been, where we're going, and where we're going to go in the future. And I thank you for doing it in advance, because this is very important from an evaluation standpoint. I would like to make one just suggestion, only because it is relevant. I think that the leapfrog score, while it's a relevant score, it's not relevant in the sense of in the fiscal year. Leapfrog scores are always looking behind. They're not current. So HCAPs are current. Leapfrog actually is a community resource. They're a separate entity. They do it, but you have to wait for the data to be able to even get the score, and it always lags behind. So you never know, even though you got the relevant score, it wasn't for what you just did. It was a year and a half. So part of the problem is until we have Cerner implemented, we don't even have the ability to draw down the metrics to be able to meet the criteria for that tool. So if I have to send off things to a group and say, how do you measure this? How do you measure that? We don't have that electronic system that can easily pull that data. So it's always going to be a default for us, if that makes any sense.
All right. I understand what you're saying, but I'd still like to have it in there so that when all of these numbers are available, then we can still look at them, and even though they may be looking backward, it's important to know what the trends are. And so if at the end of 25 fiscal year, we don't have those numbers, then we just say we didn't have the numbers. But I'd like to have it in there for future reference. I want to thank you very much for taking some time to do this, but I think an additional responsibility, quite frankly, I think I certainly am not an expert on putting these things together. And that's why I would defer to our HR director to help us with deliverables so that there are some specificity in some of these goals and accomplishments for the year. And I would hope that we could put that together certainly no later than the end of the first quarter of the fiscal year, so that they would be fair fair game for the CEO for the 25 fiscal year. Does that make any sense?
Yes.
Oh, yes.
One of the things that I think begs to be pointed out is the HCAP scores make up a big part of the leapfrog score. So if you're weighing him on the HCAP score separately and then following that back up with he's either being doubly awarded or doubly penalized for the same information. So I would feel like it's one or the other. I think there are other quality metrics that we can look at that if we're talking about hospital-wide initiatives that are happening in quality, that would be a better mark of what that is, and maybe figure out which one, either HCAPS or Leapfrog or whatever, but such a big part of HCAPS makes up what's in Leapfrog that it's not fair either way.
I can appreciate that. But I would say we need to come to that conclusion and have all of that done. You all know that better than we do. And I would say I would like to be able to make that determination and what the deliverables are, certainly over the next few weeks, to have that sent back to us as a committee so that we can look at it, review it, have a quick meeting, and approve so that we can move ahead at the following board meeting to make those recommendations for the CEO.
If you could do me a favor, or our committee a favor, and maybe put together what these metrics are that you feel like would be adequate to be measurable, and then also what, not just the name of the acronym, but like tell us what that is.
Yeah.
Give us a diverse approach to that. So lots of different areas of quality of care. So in our last board meeting, when we're looking at the quality of care report, and we have literally the Excel's table, and then we have a one-pager, how does that fit back to what is being presented to me as a board member every single meeting, right? So how does that tie? So I think that is one way from a monthly visibility, we can track it, keep up with it. But I do think that some of us, obviously not in the biz, all the acronyms and the different pieces we just don't understand. So that's where I agree with Mr. Lesser that we would want to lean in and have you help us, give us some definitions, and then we can, and information we can help decide.
Agreed.
So I would hope, given that if we have agreement on that, and it sounds like we do, that the deliverables and anything else that you think might be appropriate to help us understand how to accurately do a review and assessment could be forwarded back to us by a date certain, because I don't want to just leave it out there, because then it won't happen. And I don't know, I know you all have heavy workloads, but I don't think this is going to take too much time to put together.
I was going to ask if we were able to get kind of what we want in this review together and then get it back to you all. Could you say maybe in a month? Add in what you think the deliverables would be. And as we get and the committee can review it and tighten it up so we're not backed up against.
So with a timeline like that, if I might, Madam Chair, if August 1st, if we got that back no later than August 1st, which is what, 6 weeks, then we could have a quick meeting that would give us enough advance notice for the full board meeting in August. And that way, there would be 10 months of the 12-month fiscal year for the CEO to have a legitimate review.
Yes. And then he has enough notice as well. And
Right.
everyone to
And
know
then
what
maybe
they're being
even for
evaluated.
26 fiscal year, we'd actually have a full year.
Ooh, wait.
One of the things that I would say, though, we do need some impact, some information from you. Like, when I look at this from a Baldrige examiner standpoint, I'm looking for deliverables at X to Y by a certain date. And so when we have things that are out there that says keep the hospital informed of growth initiatives. What does that mean in your eyes so that we can then formulate these deliverables appropriately? So, we need some feedback from you guys as well. What you feel like you're not getting, or what it is that you look forward to, or even I think I saw somewhere that he goes to events, and I know Diana was talking through that. He does a lot of events. He's speaking, he's on podcasts, there are things that are happening. So what is it that we're missing, that we're not getting from, or what is the board not feeling like they're receiving? So we are gonna need a lot of feedback. So this has to be like a lot of two-way communication going on as we formulate these.
I think that's a fair question. And I think I'll talk macro and micro. And I'm going to be very specific about this aspect of it. When the CEO gives a report, I'm much more interested not in hearing that last week was National Nurses Week and we celebrated. I'm interested in hearing from the CEO what the challenges are that the hospital is facing, what issues are taking most of his time, what can we as a board do to assist him in moving forward, and what are some of the big picture items that he would like for us to consider to help the board move forward and to help the hospital move forward in serving its patients. And the very specific example would be a much clearer and much more articulate ongoing discussion and report about the potential for a new hospital. Now, all of these things we've talked about here all come under this kind of notion of giving a more robust report to the board. A more robust discussion about things going on. I would fully expect that our marketing people would talk about specific events of celebration, which I certainly want to hear about because I think it's very important that we celebrate. Certainly celebrating our employees and celebrating events that occur that move our hospital forward, no doubt. But I want to hear about the issues that are most concerning to our CEO on an ongoing basis.
I would agree with that. And I would also say, as he's preparing that CEO report for every board meeting, look at this. Hey, we're not going to be able to hit this metric for XYZ reasons. Oh, we've already gotten a preview of how great we're doing on our HCAPs, and we just wanted to share that. I think it's removing that element of surprise. Hey, there are conversations with another medical facility that may pop up in the media. You all may hear this. Here's what's going on. I think it's removing the surprise and giving the committee and the board more comfort in being able to say, hey, we can effectively evaluate. And that's good and bad. And I think just making it more conversational so it looks like all of the administrative, the staff, and the team are working together with us, and we can come in and provide that support as well. Christy, you look like you had something.
Well, I
to say.
think
Ms.
there's-
Smith, excuse me.
It's fine, Christy. I think, and I agree with you, I tend to be more transparent and direct as I feel like, I feel like that's just my personality. I don't know that, quite frankly, that's been the history of the board meetings and this kind of, since we are being heard by God and everybody. I don't know that that's been the history where people have wanted to openly talk about challenges. People have wanted to openly air some things that may be of concern in a board meeting format to God and everybody. So I tend to be more of an open, transparent person like that. I just don't think that that's been the history. I think you can look at it in both veins. What I don't want to hear, because this is the only time I am here, unless I start meeting with our CEO on an ongoing and regular basis personally, I don't want to hear just pomp and circumstance and Pollyannish, everything's going fine, because that's obviously not true either. We all organizations have challenges, and so we are here to help. We are here to help guide, and we want to dig in, like Mr. Lesser said. But I do think we've got the history of not airing that laundry at times. And so I think there's maybe being thoughtful about how that can work. I would personally love to see us engage with the senior leadership team, even if it's a one-on-one. I do know it's a heavy lift, but on a more personal and regular basis, so we can have those one-on-ones if that's a more suitable and comfortable format. So I used to meet personally with the CEO of the airport once a quarter. We were all on a rotation and we met. So I do feel like there's an opportunity to get that information and to lean in where it may not be appropriate to do at a big picture.
No, I do love that, because there are some restraints as well. And I think including some of the information in the reports that we're getting, because we know, it's one band, one sound. So we know that if marketing, finance, IT are having these issues, this is the same thing the CEO would talk to us about as well. So just being more cohesive. But I do like the idea of maybe some individual consistent meetings, just so you can lay it all on the table and it not be in front of God and Channel 3 and everybody. So I understand that as well. So thank you for that. Any comment from leadership, thoughts or?
No, that's good. And
Okay.
It's good that you're requesting it as well. I know that in the past that has happened, that it's always about the availability of the board members as well. A lot of times but if you want that, I know Dr. Webb would be open to it, because we have done that in the past.
Yeah.
I do want to make sure, though, that we set the dates certain.
Okay.
So that we adhere to that schedule and make sure we move along in an appropriate and facilitated fashion. And with the assistance of the deliverables that will help us at the end of the fiscal year.
So if you all will get this, we'll get everything back by August 1st on the actual timeliness of the eval being completed by August 31st would happen. Okay. And you would be, no, the whole eval.
No.
You want to do something
Okay,
different?
what are we?
No, I want to get the deliverables back by August 1st. That's 6 weeks.
Right, August 1st.
Okay, then we have a quick committee meeting to approve or amend, and that gives us the full 7-day advance notice to put it on the August board meeting,
Which would make you on time.
which would give us a full 10 months for the CEO's performance review, which is a heck of a lot better than where we are now.
A quick question. So as we are looking through this, and I'm a metrics kind of gal, when we say, as an example, increased social media engagement, is it our intention to look at a metric at a specific time and then what that metric should be in the future? I mean, to me, that feels kind of arbitrary. Obviously, that might be a Kathy question and lean into what her metrics are. And then I think hopefully too, in a broader scope and more of a kind of a top-down perspective, these help drive, if we can get these nailed down and done well, and the metrics, these align perfectly with the metrics of all senior leadership. And then that can cascade, and he can use this information, and that drives ultimately the effectiveness, and make sure that it's in alignment. Like, for instance, Kathy's alignment with marketing ultimately aligns back to her area of responsibility under him. So I do think, mission, CEO, and objectives and goals, and then that should help facilitate throughout the entire system.
And I appreciate what you're saying, because I think maybe some of these don't have specific articulated deliverables, but I think having the statement in the review is an important reference point.
Oh, it's definitely better than where we were.
Yeah, I think you have the statement in there, and then it goes back to the broader team. Kathy, what are your what are your deliverables? That word is tearing me up today. For social media, and then because you are the marketing, if that's, I'm just using that example, you could say, oh, that's probably not the best way to translate that. Here's how we can. And so we're not going to look back in 10 months and be like, oh, we should have said
Right.
this. Kathy meant this, and we.
Right. I totally agree. I think
Okay.
that's very fair. And I would ask of you and whoever you have assisting you, determine which of these things you can recommend some deliverables and suggest maybe some of these don't get the very specific deliverables. And we can review that, but I think that would certainly be acceptable by me.
And in looking at it, I am not sure how detailed in the weeds we're going to get, but still make sure it's something we can evaluate.
I think the important thing for this, we're making progress.
Of course.
And we're better off now than we were 6 months ago.
Yeah.
And we'll do a better job for 26
For sure.
fiscal year than we are able to do for the 25 fiscal year. But I think we're getting closer. And I think that is more favorable to and more respectful of our CEO
Definitely.
as we move forward.
Definitely. I would agree 100%. Oh my gosh, everyone's smiling. This is wild.
Can I ask a random term since just to define the term, and I'd love to just hear what you have to say about this. When we say increased community engagement, when we use a community term a lot, okay? So I just like a better understanding of what we feel like that term means. We talk about the community or our community. Help me understand what you think that is, or we think that is, because I think that really helps define the audience and the parameters as well. So,
To me, it is about a wide range of audiences. It is about certainly our patients, the people who utilize the services of this hospital. It is the nonprofits that I know we are associated with, but ever growing that population. It is about the business community. It is about government entities or the government leadership in this community, and making sure that ultimately the profile of this hospital, through the activities of this hospital and led by the CEO, rise the public profile in a way that gives us more opportunity to raise money, gives us more opportunity to be successful in our budgetary requests with City Hall, and gives us more of an opportunity to share what we can do with potential audience, meaning through particularly the nonprofits, potential patients, and grow the patient care opportunities throughout the community and not just in a narrow focus that may or may not exist today.
I appreciate that, and I wrote down all those terms, and I think that's one of the things I feel like I might have struggled with a little bit in defining what that means. I know what it means to me, but it feels like, maybe historically that was a different focus, or it was maybe geography bound, or maybe, but to me, community is that. It's a lot broader picture, and so I just want to make sure that I feel like when we reference the term is the same, or the goal is the same around that term, because that's a very different, if we're talking about geography versus more of a strategic community. And maybe that community is all of Nashville, and lots of different type people as we continue to focus on trying to increase our payee mix and bring more revenue, and people who can't afford services to continue to grow the benefits of the hospital and the facilities of the hospital. So love to
No,
hear
I
your
think-
opinion too. Thank
Well,
you.
for me, it's trust. It's public trust. Do policymakers trust us to come and discuss the budget and what we have going on? Does the community trust us to come in and be a patient here and bring their babies here and their grandmother? Do the nonprofits trust us to partner with us when they're thinking of innovative healthcare leaders, community leaders? Do they reach out to us to be a part of those conversations? Are our peers reaching out to us? To me, it's just, do we have that ultimate seat at the table for all conversations impacting Nashville, since that's who we're serving? And I think if there are any questions, comments, and concerns, are they reaching out to leadership, the CEO, the board, before going to the media, Twitter, things of that nature? So how do we trust each other? That's how I view it in my day job. I want to make sure if you have a problem, you come to me, I can help you resolve it, and now we can go forward. And so I think it's all the third-party partners that Mr. Lesser referenced. But I think for me, it's just that trust. And I think that's what we've been building up. And it's also probably why we haven't been as transparent about things, because you don't want that negative perception out there. So that's what it means to me, but I would defer to the administration as well. And that may have been too warm and fuzzy for you, but that's kind of how I view things.
No, I think that's totally honorable and appropriate. I guess sometimes I oversimplify in my mind that the ultimate goal here, as through my narrow lens, is to continually increase the quality of the service of our existing patients.
For sure.
And to grow that patient population. And at the same time, grow that profile in our community
Yes.
that allows us to have that trust that translates into more funding opportunities, more contributions and donations to support this incredibly honorable service this hospital provides.
Oh, yes.
And if all of these things we've suggested today come under that umbrella, I'm good with that.
Yeah.
From a staff perspective, do you have any comments on that? And since, I mean, you guys are here at the table as well.
I just want to mention that the one thing you guys have to be cognizant of is, Dr. Webb has 18 months left on an existing contract, and at some point that will be something that this board will have to look at. And you talked about succession and so forth. Eventually, Dr. Webb will retire, and you have to have a succession plan for who's going to step in behind him. No kidding, big shoes to fill, right? Literal. So that's one more point I just mentioned while you guys are talking about evals and future evals. But he's older than me, and I've only got 2.5 years left. Yeah.
For the record.
So I'll stick with the subject at hand about community.
Safe space. Yes.
Appropriate. The community piece is really important for our organization. I mean, providing care, and sorry, I just dropped a minute in my mouth, but providing care and being in the community to go to have outreach. It's Dr. Webb, it is all of the ELT members, it's our staff. I mean, so that's where we began the trust part with our relationships. Yeah. And to say that we are a safe space, we're a safe place, we care for you, you can come see us, we're not going to ask you about A, B, and C first, we're going to seek out your care. We have the food pharmacy, we have other community-based initiatives, we have more, we have research, grants, we have our foundation. And so at any given time in a month, there probably are 4 to 5. I think you said you brought a calendar. I did. So yes, nice Excel calendars. But the point is that we have at any point in time, there are probably 5 to 6, it looks like as I glance over, that are documented community events. Mm-hmm. But I want to make sure that we are clear that there's so much more that is unaccounted for in that piece of it. So it's not just Dr. Webb, but we serve as an extension of Dr. Webb from the community base, and that trust. And through that, we also bring in patients, new patients, existing patients, return patients. So all of that kind of go together as our ecosystem, the community base, the marketing piece, all of that kind of ties in together for us.
So as I'm listening to this, what's running through my mind is, how are we measuring this? And I know you have challenged us with what those metrics are. And I'm not sure that what we have on the page, even as our starting point, is the right direction that we want to be moving in. But it gives us a framework for what you guys are thinking and what you're wanting. And so if we have the leeway to come back with, these are the recommendations, this is how we can measure it, this is what we can do, because some of these, as I look at it, I'm like, I don't even know how I would possibly measure this at all. So we're going to have to figure out things that are actually measurable and feel a lot less subjective, so that, you know, at the end of the day, it's not just how we're feeling at this time.
That's a very fair point, and I appreciate that. I would challenge you not to change the goals.
No.
That's not on the table.
No.
What is on the table, your recommendations as to where it's appropriate to have deliverables and what those deliverables are, so that we can review that.
Yeah.
And we were just talking about our pillar goals, right? We have a strategic plan. We've got people, quality, stewardship, and finance. And so part of it is what are we doing? Again, everything tied to our mission, our strategic plan, going through and actually celebrating what we're doing. I think it's going to be a different way of looking at, and you will get the information regularly, monthly, so that we can go forward. And when you look at things together, not just quality, you're going to get about development. You're going to get about what we're doing in the community. You're going to get, because part of it is again, we don't tell our story as well as we could, and we really need to tell our story, because if we don't tell it, no one will.
And the best place to start doing that is at the board meetings with the board of directors, so that we can tout that throughout the community as we go about our business as well.
And I was just going to say, you know, we all come from different walks of life in all different areas of town. And I think that that's a wonderful piece. And I know we sometimes have to walk out here and agree to disagree, or, you know, maybe arm wrestle or something later. But it you know, at the end of the day, I think we're all part of the community. And I think we all, you help us know what's going on. You help us arm ourselves to be advocates in each of our respective, let's call it zip codes instead of communities, because we are, in my mind, a community in Nashville. And I know I'm here because I believe in our community. So you give us what we need, and we can talk very favorably about and lift up, you know, our hospital in areas that, you know, he may live in a different zip than me, and you may live in a different zip than me, and we, you know, all types of different areas. And to me, that's what really is needed, is that kind of rising tide of all these different people having a favorable voice in Nashville for MGH.
Definitely. And then one more comment, and then I want to make sure we get these dates aligned so we can make things happen in August. But yes.
Thank you. I've been avoiding staying off camera because of this, but
good.
just listening to.
Yes,
thank you.
yes, yes,
I'm making
yes.
it work. It's kind of Elle Driver, Quentin Tarantino look, but from Kill Bill. But just on the sidelines listening, and I appreciate that research, of course, is going to be brought in as we look at these metrics. But when we think about community engagement, I think you summarized it well, that there are different shareholders in that, whether it be payers, government, patients, patient caregivers, the workforce here. So another piece of the community engagement is bidirectional communication, and then dissemination. When we look at the mission statement of translating the findings, you know, to clinical practice, is disseminating it to a place for all of those shareholders to understand it in a common language. We don't say, you know, dumb it down, or we say plain language, because all of us represent different disciplines. So I really like that community was, as we say, operationalized I'm excited to see how that's going to be concretized and everything else. Thanks.
No, thank you. And so just to bring it full circle, I'm definitely not mad if the conversation keeps going, but I just have to leave at 4:30. So in talking to Ms. Lester, if we can have the deliverables, oh my goodness, back to us by August 1st, we could schedule a committee meeting for August 12th or 13th, which will give us enough time to post for the public. Have Ms. Lester to post the document. And so I wanted to see if the 12th or 13th was good for everybody, just to get that calendared and then to make sure that the administration has enough time to get it back to us, back to the committee.
August 12th? How early can you meet?
I can meet anytime you need.
Okay. Life.
The life of a retiree.
I only dream. Of course, we have one committee member that's not here. We will have to ask him as well. And you will not be here.
There will be a new chair at that meeting.
No.
And that is not on the table for discussion, but we will check with Dr. Fisher.
We already had this conversation. We already had this
Not Frank.
conversation.
Oh, Frank, oh, excuse me. Meeting adjourned, right?
You said the 12th?
The 12th.
I'm fine with that. What time?
Okay. I can go ahead and post that date. We can get that on the calendar. Once we get the document, I can post the document then for our packet, and we should be set.
Do we need to figure out a time?
We will, but I
Oh.
need to also poll Frank
Okay.
Stevenson since he's not here.
Okay, cool. Okay. All right. Any other questions, comments, concerns about fiscal year 2025? No. All right. Mr. Lesser.
Thank you for your leadership.
Thank y'all. Y'all have been great to work with. This was a good meeting, a really good meeting to close on. And yes, ma'am. Okay. We'll chat offline. Yes. But thank you again for all of your work and service on this, and look forward to watching y'all to see how this plays out.
Boy, you're just making it worse.
Now, listen, I'm just being fully transparent. Fully transparent. But if all hearts and minds are clear on this, I will entertain a motion to adjourn the committee meeting.
Second.
All right. This committee meeting is adjourned. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.